Hello, I'm Ruth Harrell and I'm the Director of Public Health for Plymouth. I understand people are worried by this, and what was signalled on the 12th of March by the move into the delay stage was that the virus is out there in our communities and that we are going to see more cases of this. What we need to remember is that there's an awful lot of national research that's going into this, and we're following the best advice from our experts to understand how we can best minimise the risk and handle this. We know that most people that catch the coronavirus will actually have fairly mild symptoms, something like a cold or towards low level of flu. But it is much more serious for some of us, people who are older and people who've got some underlying health conditions. And that's why it's really important that we all play our part in trying to prevent the spread of this. And really we can do that by washing our hands and catching our coughs and sneezes in a tissue. What we're asking people to do is just look at their own symptoms and compare them to the guidance online. And people that have a cough, a new cough that starts and continues, or have a temperature, we're asking them to self-isolate for 7 days. And this is just to help to minimise the spread, because it's possible that it might be coronavirus, and we know that there's a period where you might be infectious, and so we want to limit that in getting out into the communities. Unfortunately, at the moment, as you'll know, there's no vaccine, there's nothing we can give you to stop you getting the coronavirus. And that's why it's really important that we take the measures that we're talking about around hand washing, but also around identifying if you do have the symptoms that might be coronavirus and isolating yourself. So what I'd suggest we all do is look at the right approved sources of this. There is a lot of information out there, and there is more that is coming out as we learn more and more about the coronavirus around the world. So what I'd suggest we do is we look at nhs.uk, particularly for information around any symptoms, and look at the gov.uk website for any further information on the coronavirus. What we have to do now that we're in the delay stage, what we have to do is assume that the virus is in our communities, and it is that now the case that there won't be quite the same level of testing. The testing will be focused on people that need it because they're more ill. So it may not be possible to give you exact numbers of how many cases there are, but what we're moving into this stage means is that we have to assume it is out there in our communities.